Welcome back, Father Kirby. Thanks for being with us again. It's always good to see you. Today we're going to talk about healthcare. That's a big topic. It is talked about extensively in every presidential or vice presidential debate. It's one of the main topics. Even with the COVID crisis, it's kind of risen the issue to a whole another level. And it's complicated because every plan every politician has is different and weird. So we need to get at foundational issues. You know, what is the Catholic Church's teaching, if it has one, on healthcare? So I ask you outright, is healthcare, is universal healthcare a human right? Yes or no? And then what exceptions or explanations do you have on top of that?
Yeah. So yes, as Catholics, as Christian believers, called by the Lord to be good Samaritans, we clearly understand that healthcare is a natural right. So universal healthcare is a Catholic concept. If we see our neighbor, a fellow human being suffering, even our enemy suffering, that we are to do what we can in order to alleviate that suffering, in order to provide healthcare. So as Catholics, as Christians, this was originally our issue. Like I should remind the listeners that, before the Christian faith, before there was the Roman Catholic Church, we didn't have orphanages, we didn't have hospitals, we didn't have what we call social outreach centers, we didn't have hospices, because of our belief that God became a man and the dignity of every human life. We created at great sacrifice hospitals and orphanages and outreach centers and hospices and the vast array of human services, because we see the care of the human family as an essential role and vocation of the Catholic Church.
Wow. So are you saying that I need to vote for Joe Biden because he's in favor of Obamacare?
So taking myself away from any candidate, I'll say this, that with that all said, we also come right back. And again, as Catholics, we have this solidarity, but subsidiarity. So solidarity, everyone should receive health care. We should try to care for our neighbor. But then here comes subsidiarity. As Catholics, our Catholic social teaching has always been uncomfortable with government controlling human services. Services,
okay.
Especially healthcare, right? So the idea that this would be a federalized program and everyone would be required to have the same level of coverage and the government would control this could become very dangerous. So for example, in the Netherlands, we see they did this some decades ago. And at this point, euthanasia is the law of the land. Because if someone gets seriously ill, they have to go and they have to make petitions before a government board.
Death panels.
Yes, exactly. So when those were spoken of, the death panels, there was precedence in the Netherlands and other parts of the world for that right drawing attention to the possibility of something like that. So as Catholics, and as a church, we've never felt comfortable with government having that authority. Just think about that. Government controls your health care. Right. You're in pain and the government decides whether that will be alleviated or not. Government shouldn't have that type of power. Government's in charge of the military, coinage, and making sure that we have safe roads, okay? Not in charge of whether or not I get a CAT scan or an MRI or something.
You're drawing a vital distinction. And again, I think the left has been much more successful at controlling the jargon, controlling the language, the semantics of things. Because I think even conservatives and reacting to the leftist and the reacting to Obamacare, reacting to government healthcare, they're tempted to say, no, healthcare is not a right. I think we're tempted to say that. You're drawing an amazingly important distinction of healthcare, universal healthcare, which just means healthcare for all people, whether they're your friends or your enemies. Yes. That's a human right. And I loved how you steep that in our incarnational faith. If Christ found it important enough to become flesh, then it is, and he has enhanced the dignity of all human beings so much by his unifying with us. And each person is made in the image and likeness of God. from the very beginning, but we've been brought up to a much greater extent with the incarnation. The glory of connecting God and creation, creator and creation is staggering. That, an individual, like the Samaritan, like the wounded person on the side of the road in the Good Samaritan parable. So these people, all people deserve some form of health care.
Yes.
The question is who gives it? Exactly. That's the whole question. And it's considered just a given that it has to, if health cares are right, then the government has to give it. I'm in Charlotte, near Charlotte, North Carolina, and we all grew up going to Mercy Hospital, which was named for the Sisters of Mercy. I mean, all of the hospitals at one point in this country seem to be controlled by religious sisters. That was the way healthcare was given. And now we're going to end up with death panels if we're not careful, just like the Netherlands, the government getting to decide whether my kid gets a certain treatment or not.
Yes.
So, but it's hard, Father. Let's talk about this. People say the free market controls healthcare or the government controls healthcare. What do you do with that dichotomy? I mean, yes. If the church, if these other groups, if, cooperatives should be stepping up and providing healthcare. I mean, I don't know if you call that the free market or what you call it, but it's almost a third way in a sense.
Yeah. So in our Catholic moral teaching, our social doctrine, when we speak of solidarity, so I'm a brother or a sister to all men and women. Every Christian is this sibling to the other. And then subsidiarity, which is we break it down to the lowest and best possible level. So these two principles. In that understanding, we also speak of intermediate groups. These are very important. So, for example, probably the most romantic image we can come up with, is the guild systems of the Middle Ages. So that, you had all the blacksmiths together and all the tailors together and so on. So that there would be these intermediate groups. So, for example, churches would be considered, parish communities as intermediate groups, professional organizations, intermediate groups, and so on. And really, in our Catholic social doctrine, that's where we would see, any type of program of healthcare that ideally would come from. So, for example, before the Affordable Care Act, I know that some of my parishioners every once in a while would have me fill out a form saying that they're active in the parish, they practice the Christian faith, and so on, because they need that form because they were a member of a Christian healthcare co-op.
Yeah.
So that's a group of believers coming together and having a co-op. That's a great example of subsidiarity and universal health care. Also, the argument is a 25-year-old need the exact same coverage as a 75-year-old. And should the 25-year-old be at a freedom to make that decision? Like, all right, I'm going to get the very minimum. I'm a healthy 25-year-old, so I'm going to get a lower form of coverage. Perhaps like with a organization or association that targets college students or young adults, young professionals, and so on. So again, is the free market a part of it? Yes. Do we have to be careful that it doesn't become overly monetarized? Of course. But at the end of the day, we don't want the government to control this. And these intermediate groups, professional associations, faith-based organizations, and so on, that's the ideal in order for this universal healthcare coverage to be provided.
Father, you've talked before to us about how solidarity, when taken to an extreme, can kind of lead towards socialism. So, socialized medicine is something that we talk a lot about. So, talk about how that is an extreme, therefore an incorrect statement of an underlying truth of solidarity.
Yes, actually, so solidarity taken to the extreme is fascism, right?
Fascism.
Your point, solidarity to the extreme is socialism. And to the point you're making, which is when we allow government, so when solidarity becomes bloated, right, and it's not tempered by subsidiarity, then what we end up having is socialism.
Right.
And the idea of many people, which is why, to your point, a lot of people oppose when they hear universal health care. They think because now universal health care has become almost this buzzword, this synonym for socialized medicine. And as Catholics, with our social doctrine, we would say, no, I mean, we can have solidarity with subsidiarity, and we can provide for this basic human right for healthcare, but we have other means other than to allow solidarity to be so bloated and extreme that it now becomes socialized medicine. Like, and I just want to stress, I mean, I went to seminary in Italy that has socialized medicine. Socialized medicine is dangerous. You don't get cared for. The level of quality is diminished. There's no extra funds or grants for research, which means medical science stagnates. There are some pretty serious consequences when you begin to speak of socialized medicine. First and foremost, government controls your health. Let's not forget that. And of course, all the other things that I've mentioned that people can identify.
Don't you have a degree in bioethics or something to that effect?
I do. So my doctorate's in morals, and then there's a master's in bioethics. Yep.
So the last point you made about, when you have government-controlled medicine, healthcare, the research, suffers, and it seems like when they do research, they don't seem to have the moral norms, associated with it, and it seems like an increasing issue that's not going away is a bioethics, whether you're talking about cloning, embryonic manipulation, genetic manipulation, it's happening everywhere. Experimental drugs, even people are talking about, vaccines now that for COVID that will change your DNA, not just boost your immunity system. I mean, there's all kinds of bioethics issues at large. They're not going away. They're only getting bigger. And it seems to me that if the government controls all of our healthcare, they're the last ones who are going to be thinking about bioethical considerations. They're just going to go for what's expedient for themselves. So what do you say about how, if it's government controlling healthcare, what are the bioethical considerations that follow?
Yes, I think you make a great point, Connor, in that there won't be any bioethical dilemmas because, to your point, they won't be raised. Because if government controls, then it becomes simply about efficiency. It becomes about the process. It becomes the bureaucracy. Anyone who knows a veteran and has spoken with them about the care that they receive through the VA can be the best of witnesses to say this is not ideal.
Yeah.
So it was only by allowing a private option to our veterans that kind of enhanced the VA, because now the VA realized, oh, we have to compete for business. So it intensifies the care, the attentiveness to the patient, the follow-ups, the expediency of appointments, and then, of course, the possibility of further research to enhance medical sciences. So, I mean, in many respects, like, we can look even within our own country in terms of the VA hospitals to see a historic example of how socialized medicine does not work, and it hurts the person. At the end of the day, like, what do we want as Catholics? Like, we want to know that if a human being is hurt and is suffering, that they will be provided with the care that they need. All right, that in the end. So, as we both referenced, the Good Samaritan, the wounded person, right? The formalization of that, the program of that, as we're both talking about, like, we have concerns with the government, and there are legitimate concerns. If people dismiss that, especially Americans, you can just tell that they have not looked elsewhere in the country. And I would say just
in the world.
The world. Just look, like, I mean, and I point to the Netherlands in particular because, the expression is, as the Netherlands, so Europe, as Europe, so the United States, as the United States, so the world. Yeah. No, we don't have to follow that. We can go and look and say, what's happening with the Netherlands when they do this? And we can see exactly what's happening. Like, death panels are not an exaggeration. That's not a fear tactic. That happens, right? So we just want to make sure that government is kept in its proper place, fulfills its proper role, and that we empower these intermediate groups that they can begin to provide the proper healthcare that people need.
Well, it seems to me that, when no one enjoys going to the DMV. And most people in most areas of the country are not pleased with the public education system. You know, if they had an option to get out, they would, and most people do when they can. I do not understand why people are in favor of government health care. I mean, I just don't get, I mean, setting aside the morality of it, just the effectiveness of the government running these complex organizations. I just don't understand. So, you know, I was, my wife was given birth one of the many times she's done so. And I think it was the anesthesiologist who came in the room, and he was an immigrant from somewhere. And he explained he got out of his country because he didn't want to be a part of socialized medicine. And he said he came kind of to the promised land of medicine because it was not government run healthcare. And now, but in his career, he's seen it going that way. And he's saying, where do I go now? I mean, he was basically saying these people who are pushing this agenda, and just like you were saying, they have no idea how bad it is in other places. I don't pretend to know, you know, I'm born and raised here. I lived overseas for a while, but I don't pretend to know. But I'm able to look around and say, everybody wants to come to this country. You know, everybody wants to come here, especially when they're sick. You know, I mean, I don't see Levine's Children's Hospital taking place in, you know, Bulgaria or something. You know, I mean, you know, there's amazing research centers and cancer treatment centers, St. Jude's Hospital. I mean, these amazing places, you know, you're not trying to get to the third world and socialized nations. You know, who's trying to go to Venezuela, you know, if their kid has cancer, you know? Yeah. So, you know, you don't even need necessarily the moral component of this to look at the practicality, but when you're in the practical discussion, everyone has an argument. But what we don't necessarily have is the teachings of the Catholic Church. And the teachings of the Catholic Church, as you've well stated here, is that healthcare is a right. And I think that's important. I think conservatives do themselves a disservice by kind of arguing that it's not, or not knowing that that healthcare is a natural right. And I think you stated it so well. We need to start saying, you're right, it is a universal right, a human right, but who gives it? Who gives it is the whole question. And I don't think that the conservatives do very well at handling that. So, you know, I think this, you know, the church, once again, the church's teaching, the church's principles are such good guiding principles for the voter going into the booth. So, you know, in conclusion, Father, what would you say to that voter who's hearing all of the healthcare debates, you know, who's worried about, you know, their own medical care as they get older, or the medical care of their children as they grow, you know? So what are the, you know, maybe it's just a restatement of what you said, but what would you tell that voter going in who's really, you know, concerned about government healthcare and the fact that they like it, that they really support this, and they're hearing these warring sides in the media and in politics? You know, what's that final thought that they should be having when they're going into the voting booth in regards, at least to healthcare? I'm sure you'd say that the preeminent issue is the pro-life, which we've talked about before.
Yes.
But after they've grappled with that one, what's the final thought on healthcare, and how does that form and guide their conscience before they pull the lever for one candidate or another?
Yes, I would say that with healthcare, that your family members and the neighbors closest to you are the ones who will care and champion for you the most. And so the closest your healthcare can be to your family and to your direct neighbors or your coworkers, the better. And as Catholics, we argue for the natural right of healthcare, but we do not and are not comfortable with government controlling the exercise of that right.
You know, it's really beautiful. And, you know, I remember one little healthcare issue that we had personally in our family was when my mother's mother, my grandmother, was dying a rather slow and kind of difficult death. You were there providing guidance for our family on a number of difficult issues in terms of feeding and drinking and different, just all the many difficult issues that come up with a long, prolonged death process. And you guided us so intellectually in the mind of the church, but with such great charity. You were such a huge spiritual support to the family. So, I listened to you on all these issues, but this one, kind of struck home a little bit with us. So I thank you for that. And I thank you for your ministry and for your time, kind of helping the Catholic voter form their conscience. It's an important thing. And I do think that this election personally we say it every 4 years, but I don't see how you get to be a bigger, voting issue than this election, with two such different candidates and so many important things, preeminently being life. But in this issue, the preeminence of life doesn't get separated from the national health care, because if government controls our health care, you better believe that that abortion is going to be on their docket, and euthanasia. So you've given us great wisdom and guidance. So I thank you, and I encourage all those voters to share this video and help their family and friends form their conscience. So with that, God bless you, Father. Thanks for being here.
Thanks, Connor. Take care.